My name is Andrea Paulo. I'm going to be doing my presentation on promoting healthy skin and feet in the elderly. And this is for gerontology and end-of-life care class. This is July 29th, 2016. Okay, a lot of people don't know it, but skin is the largest organ in the body. We don't typically classify this as an organ, and when the elderly come to us in the hospital, it's not one of the first things we assess. Our main focus is on maintaining their conditions that they come into us with, or maintaining maybe their acute illness or chronic illness. So it's not something that we typically assess, but a lot of times they do have issues with it, and so it is something that's very important to assess. Skin is something that maintains homeostasis for us. It's something that protects us from heat, cold, trauma, pressure, protects us from the environment basically. So it is something that's very important to us and to the elderly in particular. Our feet as well. It's very sensitive. It relays messages to the brain. It absorbs, it reflects, it absorbs pressure. The feet. So the feet are important as well. The feet, a lot of times when we're walking, they absorb the different surfaces or change to the different surfaces as we walk. The feet basically put up our whole body weight or carry our whole body weight. So when problems go unresolved or a lot of times problems go unnoticed because it's not typically something that we assess. According to TUI and JET in 2014, when the integument malfunctions or is overwhelmed, discomfort, disfigurement, or death may ensue. So, again, skin is something that is very important and something that we do need to assess in the elderly, skin and feet. A lot of times changes may come from the environment, such as sun exposure when they were younger, or it could just be age-related. So, changes. What are some changes and trends in the skin? So, the elasticity. So, collagen decreases. What is collagen? Collagen is what gives us our thin and fragility. So, a lot of times they come to us and their skin is see-through or very fragile. That's the collagen that is decreased. The elastin fibers also thicken, and a lot of times tearing is happens very easy, or the skin doesn't stretch as easy. So a lot of times their skin is sagging, and that's because of the elastin fibers. The elastin has become fragmented. So a lot of times if you do this to the elderly, that's because they're elastin. It won't stretch back as easily as ours does. Also, their subcutaneous fat becomes thinner. They lose their adipose tissue, so they can't control their temperature. They become more hot quicker, or they become colder more quicker, so they have to watch for extreme temperatures. Skin also becomes more dry because the sebaceous oils, the glands don't produce anymore. So that leads me to the next slide. And xerosis develops. That's one of the major skin conditions in the elderly. Xerosis is extremely dry, cracked, and itchy skin, according to TUI and JET 2014. And here's a picture of that. And unfortunately, a lot of times when they try to relieve this, they take a hot bath, and that's one things that we don't recommend. We recommend like tepid water or oatmeal baths or Epsom salt. And one of the consequences of this is they itch, and that's pruritus, which is another skin condition, and that can lead to inflammation, or even sometimes they can develop infections. So we tell them to try not to itch their skin because they can get infections. Purpura is another condition, which is the picture here. And a lot of times they have very, very thin blood vessels, which causes blood to leak out, especially if they've had some trauma to their skin. So if they bumped into something or if somebody has grabbed their arm or their hand, they will have very tiny dots on their forearm or their hand, which is where this is most commonly seen. So you just have to be very careful with them. Next. Another common skin condition is herpes zoster or shingles, and this most commonly happens in people who are immunocompromised or on immunosuppressive drugs. And this is a reactivation of a latent varicella zoster virus. And it usually happens along a dermatome, or you'll see it sometimes right here. That's the most common area, which is shown in this picture. Sometimes it can even happen in the cervical area, the lumbar area, or the sacral area. And the only way to relieve the pain which comes with this is to try an antiviral agent. This is very, very contagious until it becomes crusty. We recommend getting the zoster vaccine until they are 60 or older, or for those who are 60 or older. Cancer of the skin is also a very common skin condition. You have your basal cell, your squamous cell, and your melanoma. Melanoma is the deadliest. Basal cell is slow growing and metastasis is rare. This is most commonly caused by sun exposure. Squamous cell is aggressive and can cause metastasis and also caused by sun exposure. Melanoma, again, is a neoplasm of the melanocytes, and metastasis is very common. This is the most common one that causes death. This can be caused from blisters from sunburns, sunbathing in tanning beds, or even carcinogenic materials, those who have been exposed to those. According to TUI and JET in 2014, most frequently pressure ulcers are another common skin condition, and TUI and JET in 2014 stated most older people account for 70% of all pressure ulcers, which is sad. Pressure ulcers, I'm sure a lot of us have come in contact with, and we've seen them on the sacrum, the greater trochanters, and the heels, which is where most of the pressure that these people experience. And these people are anemic, they're malnourished, they are dehydrated, they experience a lot of friction, so this is why pressure ulcers are more common. Next. Another thing on pressure ulcers, so you have your stage 1, stage 2, stage 3, stage 4, and unstageable. So it's best to assess them when they come in and look at their skin so that you can stage that pressure ulcer the right way. So the foot, you also have your health concerns and trends. According to TUI and JET in 2014, 90% of adults 65 years of age and older have some form of altered foot integrity, such as nail fungus, dry skin, and corns and calluses. So again, the foot isn't something we assess quite often when they come into the hospital or health setting, but it is something that we definitely need to assess because these go unnoticed quite a bit. A lot of times they don't say anything about their foot until they're unable to walk on their foot, and that's when we notice these types of conditions. So a lot of times these people have diabetes, they have peripheral vascular disease, so these can cause great problems. Corns and calluses are very common, and these are caused by a lot of pressure on the skin, and it's caused by compacted skin. So from not wearing good shoes, and it's caused by, the friction rubbing together. A lot of times they'll try to scrape these off on their own, but we recommend having a doctor look at it. We recommend proper shoes. Bunions are bony deformities, and this is also caused by friction or pressure from not wearing proper shoes. this is something that can be surgically removed, or just choosing the right foot or shoe. They can also try corticosteroids or NSAIDs to relieve the pain, because these can be very painful. Then you also have your hammer toe, which is shown here in the picture. This is a result of pressure from the big toe slanting toward the second toe, as you can see, or muscle imbalance. This is surgically removed or surgically fixed, or choosing proper shoes. Most of the time surgically fixed. And then you have fungal infections, which can cause a decrease in circulation. So it's definitely best to have those checked out. You can sometimes see brittle nails. You can see a discoloration in the nail. So a lot of times they require antifungal treatment. Next. So a lot of people seem to be concerned about wrinkles, sunspots, but they don't seem too concerned about skin cancer. And a lot of times these people have been out in the sun when they were younger. So this is something that we need to push for and have them look at. We can approach them with the ABCD intervention or assessment. A for asymmetry. So if the mole is asymmetric, they need to be concerned. B for border, if it has a different border. C for color, so if the color is different throughout. D for diameter, so if it has a diameter greater than a pencil eraser, they definitely need to let their dermatologist or PCP know. According to Office of Women's Health in 2010, research indicates that 40 to 50% of Americans who live to age 65 will have skin cancer at least once. So that's pretty alarming, and a lot of these elderly, like I said, have been exposed to the sun when they were younger quite a bit, and now they're seeing these skin cancers form or appear. And it's the most common form in the United States, and melanoma causes death. So we need to push these assessments out there. Our goal as a nurse, we need to maintain the skin integrity, because skin, again, is the largest organ of the body. It protects us. So we need to prevent breakdown by turning these patients, these elderly. We need to push for proper nutrition. We need to look at their lab values when they come to us. We need to educate these patients about proper nutrition, hydration. We need to make sure they're wearing or relieving pressure points. You know, make sure they're not sitting for long periods of time. Reducing moisture as well. Make sure they're not sitting in a wet diaper or a wet bed for a long period. Foot care is also another big one, so make sure they're wearing proper shoes that fits to the largest foot. One foot is always larger than the other, so make sure they're getting adjusted by a podiatrist. According to TUI and Jet in 2014, nursing care of the person with foot problems should be directed toward optimal comfort and function, removing possible mechanical irritants and decreasing the likelihood of infection. So just make sure whenever they come to us that we are inspecting their skin from head to toe. We need to make sure we're looking for lesions, abrasions, you know, make sure we're looking at the foot, make sure we're bringing in wound care if necessary for pressure ulcers, or even abrasions or lesions. Make sure we seek the care of a podiatrist for people who may be diabetic or have peripheral vascular disease or even kidney disease or thyroid problems. These can require more care. Care of the toenails. So make sure, you know, as a nurse we typically don't do this, but make sure their toenails are cut proper. Make sure, you know, if you have to cut them, that you're soaking them and softening them first, and then you cut them even. Next. You may even need to call in an experienced RN or a podiatrist to do that, especially if they have diabetes. Teaching and learning. So a lot of misconceptions are out there about the elderly and health. They think they're too old to stop smoking, too old to start exercising, too old to change their diet. That's not true, so make sure you're just getting rid of those misconceptions. You're never too old to change something. Make sure you're treating them uniquely. They're their own individual. Make sure you're not talking down to them or speaking to them like they're too old. Make sure you treat them as their own individual. Euromed Info says, in addition to specific disease issues or treatment recommendations, many older adults are interested in sexuality and aging, exercise, nutrition, and other topics related to preventing illness and promoting quality of life. So make sure you're talking or engaging with them as you would anybody else. Make sure you're talking to them about topics that you would to a young adult or a teenager. Maybe not a teenager, but a young adult. You know, they want to talk to you about everything. Make sure you focus on the medical problem that's at hand, as well as maybe their social problems or physical problems or psychosocial, everything. Remember that they have changes in vision, changes in hearing, changes in sensory function. So make sure they have their glasses with them, their hearing aids. That way they're able to take in the information. So remember that they're unable to understand complex information. Make sure you're giving it to them in simple terms, a slow pace. Make sure you're not speaking too fast. Make sure you're allowing time for them to take it in. If you're giving them print, handouts or something, make sure it's in large print, make sure it's in simple terms. Make sure you're having them do a return demonstration. If you give them a medicine bottle to open, make sure you have them show you how to open it. Or an inhaler, make sure you have them show you how to do it. Reduce environment distractions. So shut the door to the room. Shut the blinds so sunlight isn't shining in their face. Make sure you have proper lighting. Some patients may not adapt to the changes, so give them time to accept these changes. Have them come back in a week to maybe take in some other changes and ask them how they like the changes. Have family and caregiver sessions. Have the family come in and speak to them with the patient. Also have the patient set goals that they want to accept. Next. So some alternative care options. You have your herbal remedies. So thyme, tea tree oil, calendula flower, gotu kola. These all help reduce inflammation and help with infection, but some medications are contraindicated with these, so you may want to check or have them check with their physician. Acupressure, where no needles are involved. These go along the meridian and help to reduce chronic pain, help to relax. Acupuncture, where needles are involved, it's the same type of method, helps to reduce chronic pain. Aromatherapy, they breathe in scents, relaxing scents like lavender, peppermint, helps to reduce chronic pain, helps to relax, helps with depression. Chiropractic, so this helps, it's using manipulation of the spine, the back. This helps to reduce chronic pain, helps to reduce headaches. Biofeedback, so this is something where they can control their heart rate, their blood pressure, their temperature, helps to relax the patient and reduce stress. And that is it. So these are my references that I used. Next. And next. And that is it as far as promoting healthy skin and feet in the elderly.